You've got questions? She's got answers. It's Ask Nurse Lisa.
Welcome to our Nurse Aide lecture series here on Ask Nurse Lisa. It is our hope that this lecture series will further prepare you and supplement your nurse aide training program. Each state is different for their certification requirements, so please check with your individual state to make sure you're covered for your exam. Today's lecture is going to be on the requirements, role, and responsibility of the nurse assistant. The nurse assistant is a valuable member of the healthcare team. The nurse assistant practices under the state license of the nursing staff that is supervising their work. Please understand there are certain things that you will be responsible for and certain things that you will not be able to do because you are not a licensed nurse. You're responsible for many things dealing with patient care as a team member, as a valuable team member of the medical staff. You need to learn how to maintain and clean, a clean and safe environment for the patient, for you. It's very important. You need to be able to respect patient and staff confidentiality. There have been several regulations that have been put in place in recent years that are very strict about patient confidentiality. They are called HIPAA regulations, and you will be hearing a lot about those at the facility or the agency or whatever employer that you work for. Not only do you need to respect confidentiality, but you need to be able to follow directions. You are dealing with the very important subject of patient care. Let it be known that the nurse aide can be the first responder in an emergency at a facility or an agency or any other place of employment. So it is very important that you understand emergency procedures such as CPR, evacuations in case of fire. Some of the facilities or agencies that you will be working with will also be assisting you in learning some of those procedures and policies. You need to be able to show respect and be sensitive to patients. That's part of being professional. For your own sake, your own health and safety, and for the safety of your patients, you need to learn and practice good, proper body mechanics when lifting, moving, turning a patient. With every year, the subject of infection control becomes even more and more important. You need to learn what using good technique and medical asepsis, how important that is in maintaining infection control. And this is becoming more and more of an important subject as many of the organisms that make us sick are becoming resistant to pharmaceutical intervention. You need to learn how to be a good listener. You need to be able to follow directions. You need to also be a good listener when it comes to your patients, because your patients can give you some big clues as to what might be fixing to happen. So you need to learn how to be a good listener. You will be doing several basic nursing skills, such as weights, measures, vital signs, assisting with activities of daily living, such as bed making. Those are all basic learning skills which you will have to be proficient in, because you will be doing quite a lot. You will need to understand that when it comes to charting and documentation, that you will have to be very, very accurate, as the patient's chart is a legal document. So legibility and accuracy are very, very important in patient charting, and we're going to go over that in future lectures. You need to be able to encourage your patients in maintaining their health through nutrition and exercise, through growth. This can be done just by listening to the patient and being very encouraging to them. But that's very, very important. You're there to provide comfort and understanding. You need to be able to complete all the tasks that are assigned to you, and if there's a task that you do not know how to do, you need to talk to your nursing supervisor for assistance. Because even a licensed registered nurse should not be doing a procedure that she is not comfortable with. So please understand, when in doubt, ask. In the role of a nurse assistant, you're expected to be a professional. In other words, you treat your patient as you would wish to be treated, with respect and care. You would treat your job with the dedication and loyalty that you would give your own family, because people have entrusted you to their care. And the nurse aide has a big role in patient care. Now, there are some very, very important things that you need to keep in mind when doing patient care in the role of a nurse assistant. To maintain privacy and respect, always knock when entering a closed door to a patient's room. That shows respect. Make sure that you talk clearly and slowly and loud enough for your patient to hear you. Talking very, very clearly is very, very important. Make sure you wear your badge, which has your name and your position there at your place of employment, and make sure that you give the patient your first name. You speak to them as you would want to be spoken to, because you would want to know who is in your room taking care of you. Always explain why you're there, what you're there to do. They will tell you if they do not wish for you to do that particular procedure or task with them, and you must respect the patient's wishes. If the patient has a problem such as dementia and cannot speak for themselves, then obviously you're going to have to do the care that patient needs, such as feeding them, cleaning them, bathing them, things like that. So, however, if the patient is quite cognizant, then they can say that they do not want a procedure done, and you will report that to the staff, that patient refused that procedure on that day. You make sure that they are comfortable and that their environment is safe. You make sure you follow universal precautions for infection control. We're going to learn about that in further lectures, about the precautions, the universal precautions in infection control. You will also learn to report anything out of the ordinary to the nursing staff, because they need to be made aware if they are not already aware. Make sure you take linens and trash to appropriate areas designated in the facilities. You will be learning how to deal with dirty linens, trash, sharps, and other things that you'll be coming in contact with, because those are safety issues, and you will be learning about that in future lectures. Please understand that dependability is very, very important. This is not a role like working at a restaurant or behind a desk. We have patients' lives at stake, so when you are assigned to work on a particular day, please understand that people are going to be counting on you. It doesn't matter about the weather, it doesn't matter about several other things. If you are not able to come to work, you make sure that you give proper notice on the fact that you will not be able to come into work that day. Now, there are certain behaviors that are very unacceptable in dealing with patient care. Being verbally or physically abusive, being lying or deceitful when talking to the patient or talking about their care, falsifying anything in your employer's records, or altering them, neglecting your duties, your assignments, disobeying an order from your nursing supervisor. Remember, you're practicing under their licensure as a nurse aide. So if you have a question about what the nursing supervisor is asking you to do, then you can go above her, because you are basically practicing under her license. So not doing what she asks you, he or she asks you to do, unless you can talk to a supervisor over that nurse, is not acceptable. Stealing or damaging property, either of the facility or the patient, friends or family members, is not acceptable. These are things that could lead to termination in employment. They are not acceptable behaviors in nursing staff or any kind of healthcare staff. Thank you for watching this lecture, and hope you found it helpful, and I will see you in the following lectures.